Welcome back to Catalyst University. My name is Kevin Tokoff. Please make sure to like this video and subscribe to my channel for future videos and notifications. Over the next few videos, we're going to be talking about the neck pain classification system, which is a systematic way that we can take patients and group them into a particular category based on their clinical presentation, signs and symptoms, and that also helps us to get a treatment approach because different categories have slightly different treatment approaches. But before we get into any of that, we need to do an introduction to neck pain and talk about some of the important risk factors for developing neck pain. So here we have two groups of risk factors. Up here are two strong risk factors. And then down here we have other reported risk factors, which aren't necessarily weak. They're just not as strong of risk factors as these first two. So that being said, these two strong risk factors, one is gender, and one is just simply having neck pain in the past. So this first one, just being female makes it much more likely that you're going to have neck pain. Again, it's not to say that men don't have neck pain, but women have a much higher incidence of neck pain than men. Also, having neck pain in the past makes it more likely that you're going to have it again. So these first two strong risk factors are pretty straightforward and understandable. Let's now go into the other reported risk factors, which again are not weak, but these are actually highly correlated with individuals who have neck pain. The first is age. Simply being older than 40 years old makes it more likely that you're going to have neck pain. You can think about this in a few ways. Number one, bad posture is associated with neck pain. The longer you live, the more time you've had to sit in a bad posture. Okay. Also, there's things like age-related changes, like degenerative joint disease, which aren't due to trauma. It's not necessarily due to diet or anything like that. But as we age, all of us, our cervical discs thin a little bit, some faster than others. And as the discs thin and desiccate, the vertebrae kind of come closer together. And that tends to lead to problems. Also have osteophyte formation, bone spurs. In some cases, even the lower cervical vertebra can fuse. And all these things can be associated with pain in the neck. So age is the first thing. Now these next three, high job demands, low social or work support, and history of smoking, I don't really need to convince you that those can all increase stress. But let's dive into it anyway. So high job demands. So what does that mean? That could mean a lot of things. It could be that you're doing a very physical job. It could be that it's cognitively or mentally taxing. It could be psychologically taxing. It could even be something as simple as a lot of work hours. I recently treated a patient who was working anywhere between 80 and 100 hours a week at his job. Now, that's over twice what most people in the United States are working as full-time, which is 40 hours per week. And in that case, it's not even as relevant if it's physical or cognitively demanding. That's a time consideration. That's a huge amount of time that you're at work. So that would be high job demand. Also, low social or work support. So having an unsupportive boss, having coworkers that are not nice people to you, that make your life at work miserable, even having unsupportive family or being a single mother and having to take care of a child. All those things cause stress. And then we have history of smoking. Now, most people that smoke cigarettes will probably tell you that it relaxes them or in the given moment it reduces anxiety. However, actually smoking puts a huge physiological stress on your body, particularly the cardiovascular system. And over time, it can lead to issues with the musculoskeletal system, including those in the cervical spine. Now, back to high job demands. So when we think of high job demands, we said time, we think of a physically grueling job, maybe like in construction or something like that. But there's other types of demands that we don't normally think about. Like, what about if somebody works 40 hours a week and most of those hours they're required to use a computer? Well, looking over a computer for long periods of time, people tend to have this prolonged slump and poor posture. This is your upper cross syndrome that we've talked about in a previous video. And so what we typically see with this are tight upper traps and levator scapulae, tight chest muscles, which include pectoralis major and minor, and then some of these muscles that draw the scapulas together, like the rhomboids, the middle traps. They tend to be weak. And the same thing of the deep neck flexor muscle group. They also tend to be weak. And so having to look over a computer like that for long hours every single day leads to chronically poor posture and prolonged slump. which is associated with upper cross syndrome. It's also associated with thoracic hyperkyphosis. When you're leaned over like this, your T-spine tends to get a little bit excessive kyphosis than it ought to have. Remember, the thoracic spine should have a normal amount of kyphosis, but we're talking about excessive kyphosis, which would be characteristic also in this upper cross syndrome. And then you also tend to have lumbar muscle weakness, particularly of the paraspinals and the multifidi. Now, the reason I bring up this lumbar paraspinal weakness, even though we're in the neck, is because if you look over here, another risk factor for developing neck pain is having had low back pain in the past. So a prior history of low back pain makes it more likely that you'll develop neck pain. And remember that low back pain can originate from a lot of different sources, not limited to weakness of the paraspinal muscles, hypomobility, hypermobility. I mentioned these right here because all three of these can also cause pain in the neck as well. Now, in particular, the upper cross syndrome and thoracic hyperkyphosis tend to be associated with tight muscles in the cervical spine. These are by no means the only muscles that can be tight in this area. However, clinically speaking, they're some of the more common ones that you'll see. So, for example, tight upper traps. I would say that a huge percentage of people that come in, regardless of whether or not they have neck pain, have tight upper traps. It has to do with our lifestyle, our prolonged posturing and stress, right? Suboccipitals, the deep neck extensors, also tend to be tight. Scalenes, levator scapulae, and there's of course many others including pectoralis minor. Chronic stress also can cause some of these muscles to become tight, and notice I say chronic stress. Acute stress is probably okay in most circumstances because with acute stress, it's short-lived. That's what acute means. So you get a stress response and then it dies down to baseline. But in chronic stress, our sympathetic nervous system, the fight or flight system of the body, remains hyperactive to some extent for too long. And so when it becomes active for too long, some of these muscles kind of adapt to becoming tight. And so in some patients, part of the strategy for getting these muscles to loosen up is not just stretches and soft tissue massage. It might also be stress management strategies. Now, tight muscles and some of these things like upper cross syndrome, thoracic hyperkyphosis, among other things like trauma, motor vehicle accidents, can produce some of these things right here. Mobility deficits with associated neck pain, radicular signs and symptoms with associated neck pain, cervicogenic headache, and what's common between all three of these things? Pain. Now, in some, but not all cases, this neck pain can lead into what we call this fear avoidance cycle. In this picture right here, it is grossly simplified. We'll be covering it in more detail in a later video, but the basic idea is that neck pain can cause fear of movement, particularly if that movement or activity causes that pain or makes it worse. Why would somebody do an activity if it exacerbates their pain? Right? We're programmed in our society not only to shun pain, but to kind of run away from it, right? So that neck pain can lead to fear of a movement or activity, which can then lead to avoidance of that movement or activity. And avoiding it leads to weakness. It leads to hypomobility, stiffness, among other things. And these things lead to more pain. And so that pain furthers that fear, and it just goes in a vicious cycle like this. Now, not everyone is going to enter this cycle, but understand that neck pain can lead into this fear avoidance model that we'll talk about in a future video. So make sure to check out that video whenever it comes up on YouTube. The last thing we're going to cover in this video are recommended tools for developing a prognosis for neck pain. Understand that with all 5 of these right here, the higher the score, the worse the prognosis, okay? So the first one here is high pain intensity. The higher the pain intensity, the worse the prognosis. Basically, use a numeric pain rating scale, the NPRS, which is that scale of 0 to 10. Somebody has pain, and you say on a scale of 0 to 10, how bad is the pain, right? A score of 6 or greater would be considered a poor prognosis. So the higher it is, the worse the prognosis. Then we have high self-reported disability. When it comes to neck pain, the most common one that's used is the Neck Disability Index, or the NDI, which remember is a variation of the Oswestry, which is used for low back pain. So this one, we consider a score greater than 30% as a cutoff score for a bad prognosis. So on the NDI, if the score is greater than 30, it's a poor prognosis. High pain catastrophizing. Catastrophizing is basically imagining the worst possible outcome for something. To understand catastrophizing, here's an extreme example. Imagine somebody's having a muscle spasm in their left arm, and then they think they're having a heart attack. That would be an example of catastrophizing. It's probably just a muscle spasm, but they're imagining the worst possible outcome. And so to assess catastrophization, we use the pain catastrophizing scale. And we're considering a score of 20 or greater, someone at risk for a poor prognosis. Then we have high acute post-traumatic stress symptoms. This is assessed via the impact of events scale, the revised version. And a score of 33 or greater increases the risk of a poor prognosis. We won't go into much detail on that here, but understand that this scale is used to assess symptom chronicity. It is not for PTSD. It's not for post-traumatic stress disorder. That's something more for a psychologist or a psychiatrist, okay, to assess. And then we have cold hyperalgesia. So first of all, what is hyperalgesia? Hyperalgesia is an exaggerated response to a normally painful stimulus. So it would basically be like taking your fingernail and moderately hard scratching your thigh, which might cause a little discomfort, but then reporting 10 out of 10 pain and jumping off the chair because you're in so much pain. That's an extreme example of hyperalgesia, an exaggerated response to a normally painful stimulus. So hypersensitivity to pain caused by cold temperatures is also increasing the risk of a poor prognosis. We'll be going into testing this in a later video, so make sure to watch for that. So hopefully this video gave you a good understanding of the risk factors for neck pain and how to think about the prognosis for a patient with neck pain. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.